Hello and welcome to Baby Health. I'm Dr. Sandip Gupta, Senior Pediatrician and Childcare Expert. Today I'm going to talk about the role of general vaccination in children, how vaccination works, what are the benefits of vaccines, and how actually vaccines are very safe, contrary to the common belief that they can cause a lot of serious side effects and have hazards for child's health. Let me start by saying that vaccinations is the most effective way of preventing diseases, serious illnesses in children, and in healthcare we always say prevention is better than cure. So what vaccination does is it protects your child from certain serious infection which can lead to very severe illness and hospitalization and even ICU care, in some cases mortality also. So that's why we give vaccination to protect the children from certain amount of serious illnesses. So among these, vaccines are actually designed in such a way so they suit the children's age of infectivity. So certain infections are common in certain ages. So for that we need to give the vaccine at that particular age to give protection against that. So this is very important. That's why we have a pre-designed, pre-scheduled vaccination schedule and chart given to each child after birth, and some of the vaccinations are started just after birth. Also, before even discharging the child from hospital, we kind of give BCG or hepatitis B vaccine in our country to protect against these infections. So this is very important. Now, how the vaccination works? Vaccinations are actually made from the bacteria or virus particles. So what happens? Either a killed bacteria or virus is given, inoculated in a person's body, or particle of the bacteria and viruses are taken and inserted in the body to trigger an immune response. So once that particle is inside the body creates an antibody against those bacteria and viruses, and these antibody responses are stored in our immune memory. So by immune memory I mean is, once you are vaccinated, next time if you get the same disease, suppose you are vaccinated against polio and you next time get a polio virus infection, what will happen is the body will create large amount of antibody and it will kill that virus. The actual virus which is getting from the environment, that also will be killed by the immune response which is created due to the vaccine which was given some time back. So this is how it protects the child from getting serious illnesses. So where there are very successful example of how vaccination has protected child's health in the past decades. It was very common to get polio infection in our country, and it used to lead to weakness and paralysis and handicap for life. Now we see that the polio incidence has come drastically down because of very successful polio campaign in our country over the past few decades, and 2014 India became a country of polio free. So we became a polio free country in 2014 because of a massive immunization campaign. Similarly, diseases like diphtheria and pertussis in previous decades used to cause a lot of lung diseases and mortality, but that is again came down because of universal immunization all across the country, preventing these illnesses. Similarly, there was influenza infection and pneumococcal infection, serious lung disease used to happen, that also has been prevented. So these are the very important and successful vaccination campaigns which has improved children's health all over the country in a much better way. So that's how vaccine actually prevent diseases. So now, one of the most common concern in parents' mind is whether the vaccinations are safe. So vaccines are actually very safe. Not only safe, they are very safe because they get approval after long years of trial. Almost like a 5 to 10 years of trial is taken and it is tried in large population before making it available for general use. So most of the vaccines are very safe. Whatever the side effects we notice because of vaccine, they are a part of an immune response which is triggered by the vaccines. So what happens is, vaccines, like I said, they contain some particle from the bacteria or viruses, or they are killed bacteria or viruses. The moment they go into the body creates an immune response. So this immune response actually can lead to certain amount of reactions like fever, local site pain, sometimes headache and body ache. These are actually a common thing which can happen after vaccination, but these are actually a sign of beneficial response. So that we should be treated with a general medication. So what we do as pediatricians is we prescribe paracetamol along with vaccination. So if the child gets fever induced by vaccination, we can immediately give paracetamol and it will relieve the fever and child will be more comfortable. And this paracetamol is also useful for local site pain also. So when you get vaccination, you may have local site pain and little bit redness, which is again part of the inflammation reaction due to the vaccine. That also gets alleviated by giving paracetamol. If you have a little bit more degree of local pain, you can always use ice packs. That will actually relieve the pain, which is very important. So then apart from these, there are other benefits of vaccinations. Actually, vaccination protects other people in the family also from the same infection. What happens is, if your child gets influenza infection, suppose your child is not vaccinated against influenza and the child gets influenza infection, then there is a high risk of elderly people in the family, like the grandparents, getting the same infection from the child. So what happens is, these elderly people will be having comorbidities like diabetes, kidney disease, liver disease, or some lung disease like COPD. And if they get these infections, it can cause severe illness in them, requiring hospitalization or even ICU care. So this is very important to protect the people who are around the child also. So that is another important aspect of vaccination. Now another important question which commonly parents ask is giving multiple vaccines to the children is safe? So that is absolutely safe, and it is actually a routine practice. So I'll clarify this. What happens is, you give multiple vaccines at a time and they don't affect each other's efficiency or efficacy. So it will help each other in a way. So that's why vaccines are actually given in the form of combined vaccines. So we use DTP vaccines very commonly, that is protects against 3 organisms, that is diphtheria, tetanus and pertussis. Similarly, there is hexaxin vaccine, so which is prevents 6 infections like DTP, the 3 ones, diphtheria, tetanus and pertussis, along with that H. influenzae bacteria and poliovirus as well as hepatitis B virus. So these 6 infections can be prevented by giving a hexa combined vaccine. So these are there in the market, which are available and commonly given to children. So this is very important. So apart from that, another question which is commonly asked is, if by chance a child misses their scheduled or routine vaccine, then how the parents can get the same amount of protection, and how to actually make the rescheduling of the vaccine. So what happens is, when you miss a vaccine and if you have taken previous doses, so you need not repeat and begin from the beginning. The doses which you have actually missed can be rescheduled later, and you can get the same amount of, almost the same amount of immunity by scheduling it in a proper way. And there are actually catch-up schedules which can be followed, and most of the pediatricians are aware and they are doing it in a regular basis. So you can contact your pediatrician for this. I hope this video helps you in understanding the role of vaccination in children. And if you have any doubts and queries, you can ask in the comment section. I will try to reply to all the questions. And if you like this video, kindly share this video with your friends and do subscribe to my YouTube channel. Thank you for listening.